Good evening. The government says we're still not past the peak of the coronavirus outbreak, and the number of deaths is expected to increase further this week before they may start to plateau. The government insists there are some positive signs from the latest data and the lockdown is working, but it's too soon to talk about when it may end or how. 717 people are reported to have died across the UK from coronavirus in hospital, a drop from yesterday, but that number does not include deaths in care homes or in the community. It brings the total number of deaths in hospital to more than 11,000. The government has said it's reviewing whether people should generally wear face masks. The World Health Organization has acknowledged to the BBC the increasing concern in many countries that unless people wear masks more widely, they may be at greater risk of spreading the virus. Our first report tonight is from our science editor, David Shipman.
The grief is personal, but the pain can touch millions. When Anne McCook from Preston died, her smiling face was shared around the world. A source of comfort to her daughter Emma, who until the end had been looking at research into her mother's chances.
On the left, it was how many people had been admitted, and at that point she was on the left, she was in that figure. But then when she passed away on the 10th, she was on the right. She was one of the figures of death, and it's heartbreaking because to everyone else that's just a number, but that number was my mum, and I don't think people are connecting numbers and graphs and figures to real living people that aren't going to come back from this.
And Emma is desperate, like so many who've lost loved ones, for people to follow the rules. Over the holiday weekend, many usually popular spaces have been much quieter. But because of the impact of the lockdown on the economy, there are constant questions about when the measures will be relaxed. And at today's government briefing, the First Secretary, Dominic Raab, standing in for the Prime Minister, said it was still too early.
If we let up now, the virus will only take full advantage. It will spread faster and it will kill more people. If we refuse to get into it, if we keep up this incredible team effort, we will beat this virus and we will come through this national test.
In Spain, badly hit by the virus, there is a slight relaxation of the rules. Factories and construction sites are allowed to reopen. Many worry it'll lead to a resurgence of the disease. So to minimise the risk, the police are handing out masks. Until now, the World Health Organization hasn't recommended this, but it is now recognising that wearing a mask is becoming more normal around the world.
It'll become, I believe, a kind of badge of responsibility, along with the other forms of behaviour that are going to be so necessary.
So you'd expect mask wearing to become more common?
Absolutely, I'm sure. It's a way in which people themselves can take action, and it's also a sign to others that they're taking this threat seriously.
The British government view is that the best masks must be reserved for health workers on the front line. That if everyone wants them, supplies will be even harder to find. Okay. But more and more countries, including the United States, believe that because people can have the virus without showing symptoms, they should cover their faces. Is it possible that you would change your advice to the British public about wearing masks when they're out of doors?
The evidence on masks is much more persuasive for masks stopping you giving it to somebody than it is for you preventing from you catching it. We are continuing to look at new evidence as it emerges, and if there's evidence that looks like we should change our advice, we would do so.
In Thailand, even newborn babies are being given specially made face shields, an effort to protect them from the virus on the journey from the hospital to their homes. And today, more faces behind the mounting British death toll. 2 nurses. Melukayan Ballesteros, originally from the Philippines, died in London at the hospital where she worked, just 2 days after being admitted. And Rahima Sidani had spent 50 years as a nurse after arriving in the UK from Trinidad. Aged 68, she'd refused to retire in the midst of the crisis. Her son described her as a nurse until the end. David Shipman, BBC News.
Despite the government reassuring frontline health staff many times that there are sufficient stocks of personal protective equipment, there are still shortages. The head of NHS providers in England has told the BBC the supply of gowns, for example, is hand to mouth at the moment. The government says it's straining every sinew to resolve the problem. Howell Griffith reports.
Basic equipment that can save lives. Millions of gowns, masks and gloves have been promised for use in this pandemic, but they still aren't getting to everyone who needs them.
To put it politely, I think it's been a shambles.
Nick is a GP registrar at a hospital in the southeast of England who says supplies regularly run out.
You go onto a ward, you're about to see a coronavirus positive patient, and then you end up not having, if you have the mask, you don't have the goggles or the visor. If you have the visor, you then don't have the gown. These are issues that still we continue to face, no matter how our government would like to believe and say otherwise.
Across the UK, frontline staff tell a similar story. At this hospital near Cardiff, one doctor reported nurses preparing for work with 4 visors, between 40 of them. The local health board says they do now have enough PPE. Doctors, leaders and healthcare unions have written to the Welsh Government to say their members fear for their safety.
People need answers. We can't go on like this as the death toll increases, as people see colleagues, friends of theirs, loved ones dying as a result of not having the appropriate type of armour that was needed for them to go out and fight this battle for us.
The UK's 4 nations have agreed to work together on sourcing equipment. At this Belfast hospital, they have PPE, but GPs in the city have threatened to withdraw service because of the scarcity. In residential homes, there's real anxiety too. The head of Scottish Care says PPE makers have been prioritising orders from England, leaving their stocks low.
I will never stand here during this outbreak and say these things are off the agenda, because we fixed them all. We will monitor that and keep on that on a day-to-day basis, such is the vital importance of it.
Daily deliveries of equipment have been pledged as part of a round-the-clock effort to give everyone the support they need. But real questions remain over why, after months of planning, some still receive too little, too late. Howell Griffith, BBC News, Cardiff.
13 residents of a County Durham care home have died after displaying symptoms of coronavirus. Managers at Stanley Park Care Home say they are devastated by the deaths. The first fatality was in late March, with the latest confirmed today by the home's operator, Care UK. It's not been disclosed how many other residents at the 72-bed home are ill. Let's talk now to our health editor, Hugh Pym. Hugh, deaths in care homes are not included at the moment in the daily death toll we get from the government, but the government has revealed tonight new figures about the spread of the virus in care homes.
Yes, Fiona, very tragic and difficult situations in care homes with concerns about protective equipment we were hearing there earlier. Yes, Chris Whitty, the Chief Medical Advisor, said at the media conference earlier today that 13.5% of all care homes in England had had outbreaks of Covid-19. That's equivalent to more than 2,000 establishments, 92 just in the last 24 hours alone. And as you say, deaths in care homes are not reported in the daily toll which we get, which are hospitals. The Office for National Statistics will come up with some sort of figures on community deaths tomorrow.
And last month the government told us that the peak of this outbreak here would be yesterday. Today the government's telling us we're not at the peak yet. So this is not progressing the way the government expected.
Well, we may be near the peak, and if we look at the figures for hospital cases, patients there with Covid-19, you'll see a flattening of the lines there. London, which had been rising quite fast, a bit flatter now. The Midlands also was going up, that's flat. The east of England has gone up a little bit, but Scotland and Wales are plateauing as well. So this could be the beginning of a peak. And it has to be said tonight, NHS sources are making clear that there is still capacity. They've built up a lot of extra critical care beds. They can cope at the moment, but no one's taking anything for granted. This pressure may well go on for some while for the NHS.
Thank you. In France, President Macron says the country will begin to come out of its very strict lockdown in 4 weeks' time. After May the 11th, schools, nurseries and some businesses will progressively reopen. People will gradually return to work. though cafes, restaurants and cinemas will remain shut. The President says it will be possible because there will be enough tests for anyone showing coronavirus symptoms. Our Paris correspondent Lucy Williamson reports.
After a month, the unthinkable has become the barely thought about. And the extension of France's quarantine restrictions tonight caused little surprise. In a televised address, President Macron said there would be no end to the lockdown here for another 4 weeks.
From the 11th of May, we will gradually open nurseries and schools. It's a priority for me, as the current situation is widening inequality. Too many children, especially in our poorer districts and rural areas, don't have digital access and can't be helped by their parents in the same way.
Marcel runs several bars, including this one in central Paris. It's been very hard, he says. First they had to close for the Yellow Vest protests, now for coronavirus. He agrees with a suggestion put forward by France's Business Association that people will need to work more than usual after the lockdown is lifted to rebuild the economy.
I agree, even if it was a bit brutal. It needed effort from all French people. I think if you were to ask everyone to work perhaps 1 hour more each day, maybe work 40 hours a week for a year or two, but then who will pick up the bill? Businesses, bosses, workers, everyone must make an effort, a war effort.
The French finance minister has already said the country is probably facing its worst recession since the Second World War. And despite some signs that the crisis here might be easing, tonight President Macron said the lockdown would be extended again. In Spain, meanwhile, Europe's first glimpse of rush hour after Covid. Faceless commuters, more than just a cliché now. The demand for protection suggesting a certain nervousness. Few of those wearing masks already refused the offer of a spare. Construction and manufacturing firms are among those allowed to start work again in Spain, but most of the population still remains in quarantine. Italy is due to relax the rules for a small number of firms from tomorrow as its death toll passed 20,000. After the challenge of enforcing national lockdowns, countries across Europe are now beginning to face the equally delicate task of how to end it. Lucy Williamson, BBC News, Paris.
China has recorded its highest daily number of coronavirus infections in more than 5 weeks. The latest figures show 108 confirmed cases. Officials say almost all of them involve Chinese nationals returning from abroad. Our China correspondent, John Sudworth, is in Beijing. And John, China's where this all began, and it has already begun to return to some semblance of normality. So what's the significance of these new infections?
Well, Fiona, you're right. China is trying to return to normal, but while shops and restaurants and factories have largely reopened, the story here is still one of how far from normality we really are. 3 months after the crisis began here, most schools remain closed. There are still very strict monitoring measures in place, temperature checks, that kind of thing. And despite pushing back very hard in the early stages against restrictions on Chinese travellers, in the past 2 weeks China has essentially closed its borders to all foreign passport holders, which is why of those 108 new cases today, almost all of them are returning Chinese citizens, many of them in the far northeast of the country, crossing the land border with Russia, leading to fears of a further spread of infection there. And don't forget, Fiona, China is separately counting asymptomatic cases, more than 400 in the past few weeks alone in the city of Wuhan. So the real focus here is still very much on that danger of another spike in infections, which is why we are seeing these cautious steps towards, but are still a long, long way from normality.
John in Beijing, thank you. Lockdown has changed life for all of us, but the pandemic is having the harshest impact on the poorest communities across the UK. Many people have lost their jobs and are struggling to make ends meet, making life harder than ever. Our social affairs correspondent Michael Buchanan reports from Essex.
Clacton and the Pier are synonymous. If Clacton's doing well as a town, the Pier's doing well. Clacton Pier sits eerie and desolate, a rare sight in its mere 150-year history. It should be thriving, the Easter weekend marking the start of the season, but almost every employee, more than 80, has been furloughed. As many as 70 others probably won't get hired, a bitter blow to a fragile economy.
And for a lot of our staff that rely on, Easter and the summer months to, you get extra money, we're one of the most deprived areas of the country, and that is a very much big challenge for us.
It's not just the pier. All tourist facilities in the area have been shut, further reducing employment opportunities. Sean Allen is grateful for any and all help.
Hi, I'm going to go and top up your gas and electric and then I'll be back, okay?
A job offer to work at a caravan park was withdrawn because of the pandemic. The single dad is struggling to care for his twin sons.
I wasn't aware of how much electric they can use when they're hanging all the time. That's one of the things that's been disappearing very quick ever since the TV in the living room's been on all day, every day.
And that's why you need the top up?
Yeah, and not to mention the food parcels as well. Like just the one hot meal they get a day at school is a big help.
The Salvation Army says it's seeing a record demand for help.
In the last 11 days, we've probably supplied food and utility top-ups to about 100 or more households. So that's unprecedented really for what we normally do, which is normally maybe 4 or 5 a week.
Okay, so this is a 15th floor studio apartment that I currently have been in temporary accommodation for 2 years in. There's me, my 9-month-old daughter and a 7-year-old.
The reality of lockdown for a homeless family.
Trying to bake in there is a nightmare because if you get a washing machine on the cooker, it just makes it twice as hot.
Hayley Holmes lives in temporary accommodation in this converted office block with her 2 children. Space in their bedsit is non-existent, and since the local park was closed, there's nowhere to roam outside either.
Just to go for a wander around here, but everything's shut, so you can't go past the ducks or anything. It is literally car parks or bus station.
Across the UK, an army of volunteers and charities have stepped up to help those most in need. But families are helping each other too, sometimes in surprising ways.